This segment of CoastLife is sponsored by Beebe Healthcare.
Well, for many folks who have been on that weight loss journey, it comes with ups, it comes with downs, it comes with a lot of questions as well. Is it time to talk to a surgeon? Is it time to talk about medications? Well, we've got all of those answers for many of those questions because we've got Dr. Tarek Waked, a bariatric surgeon from Beebe Healthcare, joining us on the CoastLife couch today. Well, welcome, my friend, and thank you for being here.
Thank you for having me. It's a pleasure.
So why don't we start with maybe the beginning, and a question that a lot of people maybe don't ask themselves in this journey: what are even the causes of weight gain? Because there's more than one.
Yeah, that's a great question. So unfortunately, 30% of the American population struggles with what we call obesity. So obesity is now a disease because now we know that the excessive amount of body fat results in chronic inflammation, results in other diseases that are called weight-related diseases. So diabetes, high blood pressure, high cholesterol, fatty liver disease, sleep apnea, fatigue. So a lot of people complain of fatigue. They don't have the energy to do anything. And that's because of the chronic inflammation from that excessive amount of body fat. And so what causes that? I call it the triple factor. So nutrition, exercise or activity, and a very important factor most people forget about is biology. So what's biology? So biology is basically what are your genetics, what are your hormones. So if you have those hormones that make you gain a lot of weight, that do not suppress your appetite, that lower your calorie consumption, so you are more prone to struggling with weight problems during your life. Imagine even factors that are before you're born. So if your mother gained a lot of weight while pregnant with you, that increases your chances of gaining weight after your teenage years. So it's very important to deal with those hormones as well as the diet and the exercise.
Yeah, for sure.
So when somebody's coming to you and they want to maybe explore some of the different options, what are the kinds of questions that you're going to ask a patient so that they can know at home kind of what to consider for the different options that you have?
So basically, first I go through their diet recall. So what they're eating, what they're drinking, because most people don't focus on also what they're drinking. So there's a lot of those sugar-sweetened beverages. Even those beverages that say 0 sugar or 0 calories, if they taste sweet, that means they have sweeteners. And believe it or not, sweeteners are worse than sugar when it comes to weight gain.
Wow.
So that's what they drink, what they eat, their activity level. You know, are they active? Are they getting 5,000 to 10,000 steps a day? And then I go through their weight loss or weight gain history. So have they struggled with weight gain during their lifetime? When did that start? Did their mother gain a lot of weight? Are they taking any medications that are causing weight gain? So these are part of our comprehensive evaluation when they come and see us.
We're talking about weight gain here. That's this whole conversation, and there are two parts to it. It seems like right now there's the surgery side, there's the medication side. You know, talk about the difference between the two and what people need to consider.
So I think medications are great. Weight loss medications are very effective. We have some advanced medications nowadays. And but I always consider them as a bridge so that it can give you the opportunity to change your lifestyle. As you may know, these medications cannot be used for a lifetime. And we know around 60 to 80% of the people who stop those medications will regain the weight back if they do not continue with the lifestyle. As far as surgery, is more of a permanent solution. It's like having that medication for life. And the way it works is it gets rid of those hormones that are making you gain weight, which is what the medications usually do. With the surgery, the likelihood of you gaining that weight back goes down to 20%. Wow. With the medications is around 70 to 80%.
And I think that's a big difference. You know, that's a wide gap between the long-term efficacy of those things.
Yeah, and I don't want to say medications are not good. They are good, but they have to be for the right person with the right weight. So if you're looking to lose 20, 30 pounds only for the next 6 to 12 months, medications are great. But don't forget the triple action plan. healthy diet, activity, and biology. So biology is either medication or surgery. The most common misconception I hear from people and family of people who are thinking about doing something about their weight struggles is this the easy way out? Mm-hmm. It's definitely not the easy way out. I always say it's the healthy way out for a very common disease that's affecting 30% of the American population. Why is it the healthy way out? Well, if you have cancer, you go to the cancer doctor, you get treatment for the cancer. Obesity is a disease. You gotta go to the obesity doctor and get treatment for that. If you do only diet and exercise, the likelihood of gaining the weight back within 6 to 12 months of losing that weight is around 80%. If you do the diet, the exercise, and you treat your biology with either surgery or medications, the likelihood of keeping your weight off is around 80% for life. So it's not the easy way out. It's always a triple action plan. We gotta work with your diet, your exercise, and your biology.
So not the easy way out, maybe the effective way out.
And healthiest way out.
Yeah.
Absolutely. Yeah. So for folks who are ready to maybe make that appointment, get in touch with you, how should they get in touch with your office?
So you can either register for the seminar online through the Beebe website, or you can call our office and one of our wonderful patient care representatives will register for the seminar.
Fantastic. Well, Dr. Waked, thank you so much for coming in today.
Thank you.
And thank you for helping keep our neighbors and our friends all safe and healthy.
Absolutely. Thank you.
Of course. But we do have some more CoastLife to get to. We know that we've got many generous folks here along coastal Delmarva. Yet another way that you can give back when we get back.